Let me ask you something. Have you ever looked at a bottle of fish oil at the store and thought, should I be taking this? You're not alone. Omega-3s are everywhere, from supplements to fortified foods, and there's a good reason for that. But the real question is, what exactly do they do for your body? And do you really need them? Omega-3 fatty acids are a type of essential fat. Essential means your body can't produce them on its own. You need to get them from food. There are three main types you should know: ALA, EPA, and DHA. ALA, or alpha-linolenic acid, is found in plant-based sources like flaxseed, chia seeds, walnuts, and canola oil. EPA and DHA are mostly found in fatty fish like salmon, mackerel, sardines, and anchovies. Your body can convert a small amount of ALA into EPA and DHA, but the process is inefficient. That's why getting EPA and DHA directly from fish or supplements is often recommended. Let's start with your heart. Numerous studies have shown that EPA and DHA can reduce triglyceride levels. These are fats in your blood that, in high amounts, increase the risk of heart disease. They may also help lower blood pressure slightly, reduce plaque buildup in your arteries, and make your blood less prone to clotting. The American Heart Association actually recommends eating fish, especially fatty fish, at least twice a week for these heart protective benefits. Now, let's talk brain health. DHA is a major structural component of your brain and retina. That's why it's especially important during pregnancy and early childhood when the brain and eyes are developing. But even in adults, low levels of DHA have been associated with cognitive decline. Some research suggests that omega-3s may help slow age-related memory loss, although results are still mixed. There's also growing interest in their role in mental health. Some studies have found that omega-3s, particularly EPA, may help reduce symptoms of depression and anxiety. They're not a replacement for therapy or medication, but they might be a useful add-on in some cases. Here's another important point. Omega-3s have anti-inflammatory properties. Chronic inflammation is a root cause of many diseases, including heart disease, diabetes, arthritis, and even some cancers. Omega-3s help regulate the body's inflammatory response, which is why they're often used in the management of conditions like rheumatoid arthritis and inflammatory bowel disease. Now, the big question: should you get your omega-3s from food or supplements? The ideal source is food. Fatty fish like salmon, trout, and sardines give you a powerful combination of EPA and DHA, plus protein, vitamin D, and other nutrients. But if you don't eat fish, or don't like it, supplements can be helpful. Fish oil capsules, krill oil, and even algae-based omega-3s for vegetarians are available. Just make sure you're choosing a product that's third-party tested for purity and potency. Some low-quality supplements may contain contaminants or oxidized fats that can do more harm than good. Also, keep in mind, omega-3s can interact with blood-thinning medications. So, always talk to your doctor before starting a supplement, especially if you're on aspirin, warfarin, or similar drugs. For general health, most experts recommend about 250 to 500 milligrams of combined EPA and DHA per day. If you're dealing with high triglycerides, your doctor may recommend higher doses, often in prescription form. If you're pregnant or breastfeeding, DHA is especially important for fetal brain development, and recommendations may be closer to 200 to 300 milligrams of DHA daily. So here's the bottom line. Omega-3s are not a magic cure for anything, but they're one of the most well-researched nutrients out there, with real benefits for your heart, brain, and overall inflammation. Start with your plate. Aim for at least 2 servings of fatty fish per week. If that's not realistic for you, consider a high-quality supplement after checking with your healthcare provider. Thanks for tuning in. If you found this helpful, feel free to like and subscribe for more clear, trustworthy health info. Take care, and I'll see you next time.